Isthmus Research and Publishing House presents Breaking Chains, Overcoming Alcohol and Substance Use Disorders.
Addiction is a chronic relapsing disease. It affects the brain and body. Addiction is characterized by compulsive drug seeking and use. This happens despite harmful consequences. Addiction is a complex disease with many factors. Genetics, environment, and personal experiences play a role. Addiction changes the brain's structure and function. This leads to cravings, loss of control, and negative consequences. Addiction is a treatable disease. Treatment often involves a combination of approaches. These include medication, therapy, and support groups. Understanding how addiction affects the brain is crucial for effective treatment. Addiction is a major public health concern. It affects millions worldwide. By understanding this complex disease, we can develop better prevention and treatment strategies. Addiction hijacks the brain's reward system. The reward system is a complex network of brain regions. It controls our feelings of pleasure and motivation. Drugs of abuse flood the reward system with dopamine. Dopamine is a neurotransmitter associated with pleasure and reward. Over time, the brain adapts to the surge of dopamine. It becomes less sensitive to the drug's effects. This is called tolerance. As tolerance develops, individuals need more of the drug to achieve the desired effect. This cycle of increasing drug use reinforces the addiction. Addiction also affects other brain circuits. These include the prefrontal cortex, amygdala, and hippocampus. The prefrontal cortex is responsible for decision-making, impulse control, and planning. The amygdala plays a role in processing emotions, particularly fear and anxiety. The hippocampus is involved in learning and memory. These brain changes contribute to the characteristic behaviors of addiction. These include cravings, impulsivity, and difficulty controlling drug use. The hijacked brain prioritizes drug seeking over other essential activities. This leads to the devastating consequences associated with addiction. Neurotransmitters are chemical messengers in the brain. They allow brain cells to communicate. Dopamine is a key neurotransmitter involved in addiction. It is released in response to rewarding experiences. Drugs cause a surge of dopamine, reinforcing drug-seeking behavior. Serotonin affects mood, sleep, and appetite. Many drugs disrupt serotonin levels. Addiction also affects glutamate and GABA. This disrupts learning and memory. GABA reduces brain activity and promotes relaxation. Drugs interfere with GABA, causing anxiety and insomnia. Section 4. Tolerance, dependence, and the agony of withdrawal. Tolerance occurs when the body adapts to the presence of a drug. As a result, individuals need higher doses of the drug to achieve the same effect. This is a hallmark of addiction. Tolerance develops due to changes in brain chemistry and cell function. Dependence is another characteristic of addiction. It occurs when the body and brain become reliant on the drug to function normally. When someone is dependent on a drug, they will experience withdrawal symptoms if they stop using it. Withdrawal symptoms vary depending on the drug. Common withdrawal symptoms include anxiety, insomnia, nausea, sweating, tremors, and seizures. In severe cases, withdrawal can be life-threatening. The fear of withdrawal symptoms is a powerful motivator for continued drug use. The development of tolerance and dependence highlights the powerful hold addiction has on the brain and body. Understanding these concepts is crucial for providing effective treatment and support to individuals struggling with addiction. Medications for addiction. Medications can be an effective part of addiction treatment. They target specific neurotransmitters and brain circuits. Medications help reduce cravings, manage withdrawal, and prevent relapse. Methadone and buprenorphine treat opioid addiction. They activate opioid receptors but with milder effects. Naltrexone blocks opioid receptors, preventing euphoria. Acamprosate treats alcohol addiction by balancing brain chemicals. Disulfiram causes unpleasant effects if alcohol is consumed. Section 6. Psychosocial therapies, healing the mind. Psychosocial therapies are essential in addiction treatment. They address psychological and social aspects. Cognitive behavioral therapy, or CBT, is widely used. It helps change negative thoughts and behaviors. CBT teaches coping skills for cravings and triggers. Motivational interviewing, or MI, explores ambivalence about change. MI helps set recovery goals. It emphasizes collaboration and empowerment. Contingency management, or CM, uses positive reinforcement. It rewards achieving treatment goals. Combining therapies with medication and support groups is crucial.